Hello, beautiful people, and welcome to a new live show on AUK Radio. I'm your host, Yinka Omishore. This is a show where we talk about health and wellness. We are not here to diagnose, neither do we claim to cure, heal whatever ailment or disease. So please do seek um, your doctor's permission, especially if you're considering making changes to your health by maybe changing what you eat, exercise, and everything in between. So information, this is for informational purposes only to educate you, not to diagnose, nor cure or heal any disease. Now, with that being said, today we are going to be talking about my health, my right. Now, this is the theme for the World Health Organization's World Health Day for April 7, 2025. Now, when you hear my health, my right, what does that speak to you? Dr. Farmer said that health is every human being's fundamental right. So today, when we're talking about health, and also we're talking about our rights, advocating for ourselves, for our families, and also for our community. Understanding first and foremost, what is health? Now, I'm going to read you a short definition of the WHO for health. Now, the WHO defines health as a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. So, this definition encompasses health, meaning every aspect of our lives. So, we talked about our physical health, when we talk about our body, talks about mental health, talking also about the emotions, as well as our social well being. So when we're talking about social well-being, we're talking about our relationship with families, with co-workers, with other people, and with the community at large. So all of this encompasses what we refer to as health. So recognizing health as a right means acknowledging that every living being, that is everyone, deserves access to good quality health care, nutritious food, clean water, and of course, a safe environment. Question is, how many people have access to good quality healthcare? Now, this particular point is going to form a talk from another show we will be having on another talk we'll be having on the show in a few weeks' time. So we'll be inviting some experts to come and talk to us about our health, our rights, and of course, looking at access to good quality healthcare. Having nutritious food. How many people thinking about developing countries have access to nutritious food? Even in developed countries. Clean water, which many of us that live in developed countries take for granted. There are many people in the world that do not have access to clean water. Safe environment. How safe is our environment? And when we're talking about safety in an environment, not just from things like maybe natural disaster or war, but also about our environment, our home, our kitchens. Are they safe? Are the food and items we bring into our home, are they safe for us to eat? Are this food giving health to our bodies? Are we creating that enabling environment in our homes, in our kitchens? And if not, let's ask ourselves why and what can you and I do to create an enabling environment? I mean, we could listen to all the talks about health campaigns from now till tomorrow, but if the environment in which we live, in which we work, is not safe, it's not enabling, it's not empowering us to make the right informed choices when it comes to our health, then it pretty much have no use. So again, are we living in an enabling environment? So the WHO, for those who don't know, was established in the year 1948 to promote health, to keep the world safe, to serve the vulnerable. Now, over the years, the WHO has led many initiatives like the eradication of smallpox, the promotion of universal health coverage, and many other things. In the year 1978, so going back to the theme for this year, my health, my right, there was a declaration of Alma Ata which featured health as a fundamental human right and highlighted the importance of primary health care. So as individuals, Understanding that our health is our right also empowers us to advocate for better healthcare system, making informed choices about our well-being. Now, going back to the point of our environment, our immediate environment, our home, for example, or let's even look at the places where we go for shopping, food shopping. I'll take a supermarket, for example. You walk into your usual supermarket or your normal supermarket, the first 2 hours, we have what we refer to in the wellness field as the live foods. This is where you have your fruits and you have your vegetables. And the other hours, we have what we refer to as the dead food. Many packaged food, ultra processed food, those in the chillers, those in the freezers. And if you look at the ratio, 2 hours out of maybe 20, you have your living foods. You have your fruits and your vegetables. And the rest, you have your dead food. Yes, these packaged food have their places. But again, when it comes to shopping, price dictates our choices many times. I could go into the supermarket with my £10 note or maybe £20 in this day and age to buy things like my fruits, and what I'll find I'll be able to buy more of the packaged food for that £20 than I would for my fruits and vegetables that would not even last me long. Now, is this the way it should be? And if it's not, what are we or what are our supermarkets, food manufacturers, and even our government doing about it, or what can they do about it? We talk about informed choices, but again, is our environment or our environments, whether it be the workplaces, our homes, our community as a whole, are this environment enabling us to make the right informed choices when it comes to our health? That is the big question. So, still going on about the WHO, I just want to talk a little bit about some of the things that have been done, some of the initiatives that have been done to help to improve life, to make our health, our right, a reality. The year 2021 to 2030 was declared as a decade of healthy aging. So this was spearheaded by the WHO. Now, this initiative focuses on improving the lives of older people, because with the advent of, or the advancement rather, of technology and in the medical world, we are living longer. But the question is, are we living healthy? So this is one of the reasons why this decade of healthy aging was declared, to improve the lives of older people, their families, and of course the communities. It emphasizes integrated care, age-friendly environment, again that word environment, and combating ageism. Now, as a wellness coach as well as a certified menopause practitioner, of course, we talk when you talk about menopause, it's about, oh, I'm getting old. Well, yeah, our age, we are increasing, we're getting older, but we have a choice on how we age. Okay, this is where our healthy lifestyle choices comes into play. How are we living our daily lives? Another one to mention is what we call the Mathers Rule. In the United Kingdom, for example, it was implemented in the NHS hospitals since April last year, 2024. This initiative empowers patients and families to request a rapid review from a critical care team if the patient's family feels that the patient's condition is deteriorating, that this is getting worse. This is a step towards patient-centered care and safety. Source, Wikipedia. Another one from the United Kingdom is Our Future Health. Now, this is the UK's largest health research program, aiming to recruit millions of people to help in the prevention, detecting, and of course, in the early treatment of diseases. Participants contribute to a better understanding of health and disease. For people from my side of the world, and especially people from the Black, Asian, and ethnic minority groups, we are statistically being shown that we don't get involved in research as much, and the various reasons and factors as to why. One, not many people know what research is going on. There are some government websites that gives you information about that, so please if we want to make changes, we want to let governments make changes when it comes to policies that affect us, we need to get involved in research. Because if we're not represented in research, of course, the result or the end game of the research would not benefit us as it should if we were involved in the research from the beginning. So go online, search, how to get into research or to be involved in research, and get involved in research. All right. And some of them, and I think maybe I won't say most of them, but some of them you do get paid for your time for participating. So there's an incentive on why you should get involved in research. Now, still going on about WHO, in 1990, WHO started the campaign for healthy lifestyle. So, and this ties in with the Sustainable Development Goal of the UN, goal number 3, which is about good health and well-being. Now, the UN established this in 2015. The official word, in fact, and I quote, is to ensure healthy lives and promote well-being for all at all ages. Coming back to the point of my health, my right. Again, our health is a fundamental human right. So there are the various indicators and targets to monitor the progress. Yes, some progress have been made. Some involve maternal and child health, combating communicable diseases, also non-communicable lifestyle diseases, as well as universal health coverage. And this is where we're also talking about access to adequate quality health care. So how is that going? Well, again, you can also check that out on the UN website. That will give you more information as to the progress of this goal and a worthy one as well. I mean, there are other factors that, of course, that are related to this, which are also there's focus on that as well. But we're on the right track. A bit slow, but we're getting there, and let's just keep going. So in all of this about our health being our right, there are some health champions I would like to make mention of. Dr. Tedros, and I'm not going to attempt to pronounce the last name because I do not want to mother his last name, the current Director General of WHO, has been very instrumental in leading global health responses, including the COVID-19 pandemic. Dr. Ola Orekunrin, who is a British British Nigerian medical doctor and the founder of Flying Doctors in Nigeria, started this initiative on the back of her losing her sister, tragically, because the sister was unwell and they couldn't get her to the nearest place to get the appropriate treatment for her. This is how she gave birth, this is how she gave birth to this vision of having the Flying Doctors Nigeria, and not only in Nigeria, but it's also going to other African countries so that people are able, they're able to address, or doctors rather are able to address emergency healthcare need. Another sister in Kenya, Wangira, Mathia, is an environmentalist and the first African woman to win the Nobel Peace Prize. Now, I haven't checked that out, but do correct me if I'm wrong. She's an advocate for environmental sustainability as a key component of public health. Again, this ties in with our environment. How safe is our environment? Okay. And her initiative of the Green Belt movement connects women's empowerment, reforestation, and health. I mean, if we're cutting down trees, let's plant other ones so that we are not deforesting our forests. Of course, if we keep doing that, we won't have a forest. Another lady to mention is Dr. Angela of Rwanda. She is the former health minister in Rwanda, who, when I was reading her story, went back to Rwanda 2 years after the genocide. She has transformed Rwanda's health system post-genocide by improving, one, universal health access, community-based insurance, and digital health solution. So she currently serves as the Vice Chancellor of the University of Global Health Equity in Rwanda. And going back to our theme of health being every human's right, the late Dr. Paul Farmer of USA, the co-founder of Partners in Health, an organization that is involved in delivering healthcare to the poorest communities, he promoted that the principle that health is a human right. And there's so many other health champions we could spend the whole of the show mentioning, but those are just a few of the people I want to mention today. And just to say thank you to them for their for being brave, for their audacious decisions in bringing health, especially to the poorest communities in the world, and making health a human fundamental right. Now, when we talk about health, I always say, when the saying that when you do not know the value of a thing, abuse is inevitable. Do we know our bodies? Do we understand how the heart functions? Do we understand how or why do we blink? Do we understand how the lungs function? Now, fear not, I am not going to anatomy or physiology class today, but I just wanted to give some fascinating facts about our bodies. Our heart, for example, beats about 100,000 times a day without us even being aware of it. As I'm sitting here talking to you today, wow, I don't know how many beats I've had, but in 100,000 times a day, your heart is beating. So, and you realize that, the heart is a pump that gets the blood going through all the network of vessels that we have in our bodies, going from our head all the way to our toes. So again, kudos to the heart for the work, for the great work that the heart is doing. And did you know that your bone is 5 times stronger than steel of the same density, 5 times stronger? I mean, think about it. How wonderful this human body is. Your pinky, the smallest finger on your hand, contributes to 50% of the strength of your hand. This little finger, this little pinky, like they like to sing, the children sing the nursery rhyme about the little finger. Not so little, 50%. So all the big guys are only contributing, between them, another 50. So maybe 15, 15, 15, if my math is correct. So that's another fascinating fact about your body, about your little finger. Your skin, did you know your skin regenerates every 27 days? So yes, you do get born again and your skin every 27 days. Now, talking about acid, your stomach acid. Oh my goodness. It says the stomach lining renews itself every few days. And that's because if it doesn't, the stomach acid will eat through the tissue of the stomach. Again, another wonder of the human body. So this highlights the importance of us caring for our bodies, recognizing them as the incredible system that the body is. And to know that when we know what our body is meant to do when it's in the right, I was going to say right frame of mind, but looking after our bodies, yes, is our responsibility as much as health is our right. We also need to play our part in looking after our body, which is what this show is about, really, because we're talking and we're educating and teaching about healthy lifestyle, from making sure we're drinking enough water, making sure we're resting, we're managing stress well, we're moving our muscles, we're exercising and doing things that is good for this body. The Mother's Day talk I mentioned about, going for a spa day, we should not just make it a once in a year kind of thing. Even in your home, you might not even need to go out for a spa. You could have a spa day right in your home. Make it a once a month thing. Make it a once in every 2 weeks kind of thing with the family. Get everybody involved. Have that time. Pamper yourself. Okay, let's look after this temple because this is the only place we have to live. So we need to look after it. So moving on, I also want to touch about some latest news, and I'm sure many of our viewers have probably heard about the new drug called Mounjaro, which is to help. It's shown significant weight loss for people that have been using it, particularly diabetic patients. Again, health experts have, of course, warned against the unsupervised use of this drug due to the potential side effects. As with every drug or medicine has a side effect. So it's crucial that you consult your healthcare provider if you are thinking of using Mounjaro or, in fact, any other medication. First and foremost, speak to your healthcare provider. breast cancer treatment. The NHS England and Wales have approved a new pill to help with the treatment of advanced cancer. So those are two advancements again that when it comes to our health, when it comes to medicine usage, has happened in the last few months. So it again underscores the advancement in medicine, and of course, cautions for informed health decision. Speak to your healthcare provider. Speak to your doctor. So your health is your right and also your responsibility. I had a talk at an event I was invited to a few days ago to talk about my health and my life. And when I saw the theme for the event, I said, well, this just talks about responsibility. This is, okay, what's my responsibility when it comes to my health? What's your responsibility when it comes to your health? Our health, whether we like it or not, is in our hands. So as much as health is our right, it's also our responsibility. So let me challenge you today. Which of the health, we've shared so many healthy lifestyle tips on the show. Which of these are you taking on board? Which of these are you already practicing? Please, if you have anything you want to share on the show, whether whether you're an expert in many of the areas we've talked about, or expert in health and well-being, and you would love to come on the show, we would love to have you. So please do get in touch with us at AUK Radio, where we invite you to come and share with us, and of course our viewers, about either your experience as a patient or maybe your breast cancer survivor, or whatever it is, as long as it's got to do with health and well-being. We would love to hear from you. And like I said, it's challenging you to, okay, so what are some of the lifestyle strategies that you are thinking about starting, or that you've started and you've, dropped the ball? It's okay. Pick it up again and keep going. Take one habit at a time. Could it be you want to be drinking more water? You want to be going for walks because you haven't exercised for a long time. You want to get to bed at a reasonable time most nights in the week. Or you want to manage stress. And yes, it's very, very important that we manage stress, because when we're not managing stress, it's doing a lot of damage to our body. Okay? So your health, of course, is your right. Advocate for yourself. Advocate for your family, for your community at large. Stay informed. We talk about creating an enabling environment in the home. For example, I use myself as an example. I used to love digestive biscuits. In fact, I love pretty much biscuits. But I know if I don't buy the biscuit when I go to the supermarket, it's not in the house. That means I don't get to eat the biscuit. I don't get to eat the whole packet. And if you're like me, that you can't stop once you start one, you keep going, then don't buy it. So in that way, you are creating an enabling environment for yourself and also for your family. So if that's an issue that you're struggling with, well, challenge yourself not to buy that packet of biscuits when you go shopping again. Take action, whether it's in scheduling a health checkup for yourself, joining a health initiative, taking up one or two of the challenges that I've mentioned already, or simply sharing information, like maybe share the link to this recording today to help somebody. Every step counts. It's your health, it's your right, and it's also your responsibility. So let's honor our bodies, support one another, and strive for a world where health is truly a right for all of us. So as I wrap up today's show, I want to say thank you for joining me on the New Life Show on AUK Radio, where we talk all things health and well-being. And as I like to also end the show with is, let's get wealthy together by staying healthy. And until next time, take care.